everyone, welcome to our pharmacology lecture series where we explore different routes of drug administration. In today's lecture, we will focus on the parenteral route of drug administration, which involves the direct delivery of drug into the blood or into the systemic circulation. In today's lecture, we will discuss the definition of parenteral route of drug administration, different types of parenteral route of drug administration, their advantages and their disadvantages, providing you with a comprehensive understanding of this important route of drug delivery. So what is parenteral route of drug administration? It refers to the delivery of drugs or therapeutic substances directly into the body through injection or infusion, bypassing the patient's gastrointestinal tract. Unlike the anterior route of drug administration, which are through the oral or rectal route, the parenteral route of drug administration ensures rapid absorption of the drug and immediate onset of action of the drug. So there are different types of parenteral route of drug administration, like we have intravenous administration, intramuscular route of drug administration, subcutaneous administration, intradermal administration, intrathecal, intraarticular drug administration, and intraocular route of drug administration. One by one we will discuss all the types of parenteral route of drug administration, their advantages and their disadvantages. So we are going to start with the intravenous route of administration. This route involves the direct injection of the medication into a vein. Here you can see in this picture that through injection the healthcare professional giving the drug into the blood. If we talk about the advantages of intravenous route of administration, there is immediate drug effect due to the direct entry of drug into the bloodstream. The accurate administration of drug concentration can be achieved through this intravenous route of administration. We can give precise dosing through infusions and through injections. This route of administration is suitable for administering the large amount of drugs. This allows the infusion of larger volume of fluids or medication through drips or infusions. So disadvantages of intravenous route of administration are that the use of needles through this route can cause patient discomfort, pain, and anxiety. There is increased risk of infection through this route in comparison to other non-invasive route of administration, necessitating strict aseptic technique for the safety of the drug. This route requires trained professional to administer IV drug safety. After intravenous route of drug administration, we have intramuscular route of drug administration. This involves the injection of drug into a muscle. Here you can see that through this injection, drug is directly given into the muscle of the patient. So there are advantages and disadvantages of this route. Okay. So this route, intramuscular route, provides or allows for administration of substances that are poorly absorbed through the oral route of administration. We can give drugs which are poorly absorbed from the GIT, so we can use intramuscular route of administration for those drugs. Through intramuscular route, the slower drug absorption from the muscle tissue provides sustained drug levels. So the drugs releases from the site of the injection or from the muscle slowly and gradually and provide a longer duration of action. This intramuscular route can accommodate large volume of medication compared to the other routes like subcutaneous route or intradermal route. Then there are disadvantages of the intramuscular route, like this route can cause injection site pain and soreness. Improper injection techniques can lead to tissue damage or nerve injury. The drug absorption is slower through the intramuscular route as compared to the intravenous route of the drug administration. After intramuscular route, we have subcutaneous route of drug administration, and this route involves the injection of drug directly into the subcutaneous tissue layer. Here you can see that the injection is given directly into the subcutaneous layer of the skin. The main advantage of this route of drug administration is that patient can himself give the injection, and the most important drug which we can give through this route is insulin, which is used for the treatment of diabetes mellitus. So the advantages of the subcutaneous route of administration are that this route enables slow and steady drug release from the site of administration. As I told you, that patients can administer certain medication to themselves, and slower drug absorption from the subcutaneous tissue provides sustained therapeutic effect. So that will provide a longer duration of action of the drug, just like intramuscular route. Then there are disadvantages of this route, that subcutaneous route is restricted to small volumes, as large amount can cause discomfort, pain and swelling at the site of injection. So we can only administer small doses of the drug through subcutaneous route. Localized reactions such as pain, redness, tenderness or itching may occur through the subcutaneous route, and there is slower absorption of the drug through this subcutaneous route as comparison to the intravenous or intramuscular route. After subcutaneous route, we have transdermal route of drug administration. This route involves injecting drugs into the dermal layer of the skin. Here, as you can see in this picture, this is the dermis layer of the skin, and we administer drug through the injection into this layer. So the advantages of the intradermal route are that this route can be used for tuberculin skin test and for many other allergy tests. We can easily administer small volume of accurate testing. This route, the intradermal route, allows clear observation of localized skin reaction. The disadvantages of this route are that the drug absorption is slower as compared to the other parenteral route of administration. The reactions such as redness or itching may occur at the site of injection, and this route is primarily used for the diagnostic purposes rather than the therapeutic drug delivery. So after intradermal route, we have intrathecal route, and this route involves the injecting medication directly into the spinal cord, specifically into the subarachnoid space. Here you can see the site of intrathecal route of drug administration. The advantages of the intrathecal route of drug administration are that this route allows for targeted drug delivery directly into the central nervous system, and for that we can avoid the systemic side effect because we are injecting the drug directly into the spinal cord, into the central nervous system. This route can be used for the spinal anesthesia, for administering the chemotherapeutic agent, or for management of the certain neurologic condition. The disadvantage of this route, that this route is an invasive procedure and requires specialized training for safe administration of the drug. There are chances of infection, spinal cord injury or neurologic complications. There is limited accessibility due to the necessity for lumbar puncture or a specialized catheter through this route of drug administration. Then we have intra-articular route of drug administration, and this route involves injecting drugs directly into the joint space. Here you can see we can administer drug which provide relief for the joint pain and inflammation in different conditions involving the joints. So if we talk about the advantages of this route of administration, then this route provides localized relief for joint related conditions such as osteoarthritis or inflammation. The higher drug concentration can be achieved in joint fluid compared to the systemic administration of the drug, and because of that because we are administering the drug directly into the joint space, into the joint fluid, so we can decrease the chances of systemic side effect through this route. Again, this is an invasive procedure and requires proper technique to avoid joint infection or injury. This route is limited to certain joint accessible for injections, and there is potential for short-lived effect because the drugs which we administer through this route, their effects are very short-lived, so it requires repeated administration of those kind of drug directly into the joint to for the sustained relief of the pain and inflammation. Then lastly, we have intraocular route of drug administration, and this involves the delivery of the medication or drug directly into the eye through the topical route, where we apply the drug like we apply or we put the eye drops, or through the injections. So this route of like intraocular route of drug administration, it allows for targeted treatment of ocular conditions such as glaucoma or inflammation. It provides higher drug concentration in the eye compared to the systemic administration, so we can avoid many dangerous side effects of the drugs, the systemic side effects of the drug. So we can minimize the systemic side effect because we inject the drug directly into the eye. There are disadvantages of the intraocular route of drug administration also, that this route requires specialized training for safe and accurate administration. As far as we talk about the injection through given through the intraocular route of drug administration, there is potential for complications such as infection, increased intraocular pressure, or retinal damage. This route is limited to ocular condition and inaccessible for systemic drug delivery. So that was all about the parenteral route of drug administration. This route offers various routes for delivering medication directly into the systemic circulation or localized area. Each parenteral route of administration has its advantages and disadvantages, requiring careful consideration in clinical practice. So understanding the unique characteristic of each parenteral route is essential for optimizing drug therapy and ensuring patient safety. Thank you for joining me today in this lecture, and I look forward to your continued engagement and exploration of this topic. Stay informed and stay curious. In next lecture, we will discuss about the absorption of the drug and the factors which affect the absorption of the drug. Thank you so much.